It begins with a single bite. A moment that unleashes one of the most terrifying and deadly viruses known to the animal kingdom. This is rabies, a silent invader that attacks without warning and kills without mercy. In this video, we reveal what rabies really does to animals, from the subtle early signs to the devastating final stages. This is Mr. Vol TV. Imagine a virus so powerful it turns a calm creature into a frenzy of confusion, fear, and fury. A virus that travels silently through a scratch or bite, only to strike days or weeks later. It kills nearly 100% of its victims once symptoms appear. This is rabies, and no warm-blooded animal is truly safe. Yes, even humans. In the final stages, people may become unable to swallow, panic at the sight of water, and in some horrifying cases, bark like a dog. Rabies is a viral disease that infects the central and peripheral nervous system of mammals. It is a zoonotic virus, which means it spreads between animals and humans. Transmitted through the saliva of infected animals, it spreads mainly through bites, and sometimes through scratches or licking open wounds. Once the virus reaches the brain, the damage is irreversible. Death is almost certain. Any warm-blooded mammal can contract rabies. That includes cats, dogs, foxes, raccoons, skunks, bats, wolves, mongooses, ferrets, horses, cows, goats, monkeys, and humans. In the United States, raccoons, skunks, foxes, and bats are common wild carriers. In Africa and Asia, stray dogs are the leading source of rabies infections in people. The rabies virus is usually spread through a bite that pierces the skin. The infected saliva enters the wound and begins its silent journey toward the brain. From the point of entry, the virus travels along the nerves, avoiding the bloodstream and the immune system. This is why rabies can incubate undetected for weeks or even months before symptoms appear. Let's break down the 3 terrifying stages of rabies in animals. The prodromal stage. In this early phase, lasting 2 to 3 days, the infected animal begins to show subtle behavioral changes. A friendly dog may become anxious and withdrawn. A shy cat might suddenly become hyperactive. There may be fever, excessive licking of the bite site, and unusual vocalizations. The furious stage. This is the stage most people recognize. The animal becomes hypersensitive to light, sound, and movement. They may bite without warning, bark or growl incessantly, and show unprovoked aggression. Their pupils stay dilated, and they often snap at imaginary objects. During this stage, the animal is at its most dangerous. And the paralytic stage. Usually occurring 3 to 7 days after symptoms begin, the final stage brings a horrifying end. The animal begins to salivate uncontrollably as muscles in the jaw and throat become paralyzed. Swallowing becomes impossible. Eventually, full-body paralysis sets in. Death follows within hours or a couple of days. Humans are not spared from this nightmare. Once symptoms appear, the disease is almost always fatal. Victims may develop hydrophobia, an intense fear of water due to spasms in the throat. They may become disoriented, hallucinate, or exhibit bizarre behavior. In the final hours, some patients may mimic animalistic behavior, barking, growling, or gasping like a dog, mimicking the very animals the virus once infected. This is not fiction. It is documented medical reality. It's one of the most terrifying illnesses ever recorded. Animals show rabies symptoms in different ways. That's what makes this virus especially dangerous. It wears many disguises. Take foxes and raccoons, for example. These normally shy nocturnal creatures may suddenly appear in broad daylight, wandering fearlessly into towns or neighborhoods. Instead of fleeing at the sight of humans, they might approach, bold, confused, and aggressive. This unusual confidence is a red flag. Cattle, on the other hand, don't become aggressive at first. Infected cows may separate from the herd, act strangely withdrawn, or begin bellowing non-stop as if in distress. Some may develop muscle tremors, drooling, or even charge at people or objects without provocation. Horses infected with rabies may appear unusually jumpy. They can become hypersensitive to sound and touch, spooking easily, stumbling, or even collapsing without warning. Some display a dangerous mix of agitation and confusion that can make them difficult to handle. And with dogs, the symptoms can swing to either extreme. Some become dangerously aggressive, attacking anything in their path. Others grow disturbingly quiet and withdrawn, barely reacting to people or familiar surroundings. These species-specific symptoms are why rabies isn't always obvious, and why any strange behavior in animals should never be ignored. There is no reliable test for rabies in live animals. If a domestic animal bites or is bitten by another potentially infected creature, it must be quarantined for 10 days. Veterinarians will monitor for symptoms and assess vaccination history. Wild animals showing symptoms are often euthanized and tested post-mortem by examining brain tissue. There is no cure once symptoms begin. However, immediate treatment after exposure, called post-exposure prophylaxis, can prevent the virus from reaching the brain. That's why rabies vaccines are crucial for pets and at-risk humans, like veterinarians or wildlife handlers. Avoid contact with wild animals and vaccinate your pets regularly. Rabies is 100% preventable, but once symptoms appear, it is almost always 100% fatal. The key to safety is awareness, vaccination, and quick action. If you suspect exposure, seek medical attention immediately. For animals and humans alike, time is everything. Subscribe to learn more about animal diseases, wildlife safety, and nature's most shocking survival stories. Thanks for watching. See you in the next video. Goodbye.